Assalamualaikum and a very good evening. My name is Muhammad Faiz bin Muhammad Isham from Center for Communicable Disease Epidemiology Research. And today I would like to present a study entitled Evaluation of the Diagnostic Accuracy of a New Biosensors-Based Rapid Diagnostic Test for the Point-of-Care Diagnosis of Previous and Recent Dengue Infections in Malaysia. So for the introduction, dengue is a mosquito-borne infectious disease caused by the dengue virus with 4 known types, dengue 1 to dengue virus variant 4 from the genus flavivirus. So every year, approximately 390 million dengue infections occur worldwide and costing about US 8.9 billion for treatment, responsible for 566,000 years lived with disability and 576,900 years of life lost. So due to the presence of asymptomatic infection and its non-specific clinical manifestations, more accurate estimation of the true burden of dengue is required to inform the effectiveness of current preventive measures. So all of this can be achieved with the help of diagnostic tests, including serological testing as well as rapid diagnostic tests, RDTs. So this study aimed to evaluate the diagnostic accuracy of a new biosensor-based RDT for the diagnosis of past and current dengue infections. So the study design is the prospective cross-sectional diagnostic test accuracy evaluation study, and is a minimum of 500 participants with a single proportion sample size of less than 10% margin of error with type 1 error of 5%. 2 communities in Petaling were randomly selected, consist of 250 households and represent the highest and the lowest reported dengue case from 2013 to 2017. It was from 18 August to 26 October 2018, and the structured questionnaire were given to the respondent to capture socio-demographic characteristics. Capillary blood and venous blood were taken from the respondent to evaluate the index test which occurs on site, and as well as for reference standards where the blood is taken from the plain tubes and transferred to the virology lab in Kuala Lumpur. So this is the index test. The index test is a viral tract dengue serostate developed by Blue Sense Diagnostic Copenhagen. It is semi-quantitative anti-dengue immunoglobulin G (IgG) assay based on immunomagnetic agglutination IMA principle. It takes about 8 minutes to operate, and it's measured by photodetector with Blu-ray optical pickup and given in a relative unit. So this is a reference standard. It consists of 4 types of reference standard, which is HI, PRNT, FRNT, ELISA for indirect enzyme link immunosuppressive assay, and ELISA pan-bio dengue IgG capture ELISA. So HI remain gold standard for the titration and subtyping of antibodies. PRNT, FRNT is a gold standard for the differential serodiagnosis of dengue. So for the previous dengue interpretation is positive when a sample was tested positive for a minimum of 2 reference tests above. And for interpretation of recent dengue, is positive when a sample was tested positive for ELISA pan-bio dengue IgG capture ELISA. So this is the result. A total of 484 participants with a mean age of 32 with standard deviations of 18.4. Male is 250 while female is 234. Majority were Malay, 376, and previous dengue infections is 383 while recent dengue infection is 41. So this is a characterization of the 484 study participant. As we can see, previous dengue status is 383 positive, while recent dengue status for IgG capture ELISA is 41. This is the accuracy of a viral tract dengue serostate for the diagnosis of previous and recent dengue. For sensitivity, it's 91.1 for previous dengue, recent dengue 90.2. Specificity is 91.1, while the recent dengue 93.2. So this is the accuracy of a viral tract dengue serostate as compared to individual reference tests used in the reference standard of previous dengue diagnosis. As you can see, if you are using only individual reference, IgG indirect ELISA only, and HI reported to have a higher sensitivity than the previous one, whereas FRNT reported to be decreased in sensitivity. Same goes with specificity. All of these individual reference indicates decrement in the specificity. So this is the correlation between the viral tract dengue serostate with Pembio dengue IgG indirect and Pembio dengue IgG capture ELISA. This is indication of a very strong correlation and statistically significant. So as a discussion, viral tract dengue serostate performed well for the diagnosis of previous and recent dengue infections that when compared to the reference standard with sensitivity and specificity are more than 90%. And viral tract dengue serostate can be used as a component of a dengue vaccination strategy. So to conclude, this kit potentially to be applied for community-based dengue sero-epidemiological surveillance, as well as individual pre-vaccination screening and combination with its previously evaluated silbing to improve the accuracy in diagnosing acute recent dengue. So with that, I ending my session.